The Piriformis Test is a specialized clinical examination designed to assess the presence of piriformis syndrome. The piriformis muscle irritates or compresses the sciatic nerve in this neuromuscular condition. This phenomenon results in pain, numbness, and tingling sensations radiating from the buttocks to the lower extremities. Healthcare professionals, particularly physiotherapists and orthopedic specialists, rely on this valuable diagnostic tool to pinpoint the underlying cause of sciatica-like symptoms and tailor effective treatment plans accordingly. The Piriformis Test comprises a variety of maneuvers that elicit pain or discomfort, thereby indicating the involvement of the piriformis muscle. These maneuvers are performed in various positions such as supine, prone, and seated. To use our free Piriformis Test, follow these steps. Download our Piriformis Test from the Carepatron platform, which you can find in the link in the description. Firstly, position the patient. Ensure the patient is in a comfortable and relaxed state. Position the patient accordingly. Firstly, perform the straight leg raise test. With the patient in a supine position, raise their leg while keeping the knee extended and ankle dorsiflexed. Observe any pain or discomfort in the buttocks, posterior thigh, or leg. Conduct the FAIR test. Position the patient in a side-lying position. Flex, adduct, and internally rotate the patient's hip with the knee flexed at 90 degrees. Note any reproduction of buttock pain or sciatica-like symptoms. Evaluate PACE sign. Ask the patient to sit at the examination table. Instruct the patient to abduct their hip against resistance. Assess for pain or discomfort in the buttock or hip. Assess Freiberg sign. With the patient in a supine position, passively internally rotate the extended leg at the hip. Perform Beatty's test. Position the patient in a side-lying position. Ask the patient to lift their leg with the knee flexed at 90 degrees and the hip externally rotated. Look for any pain or discomfort in the buttock or hip. After completing each test, assign a score of 0 or 1 based on pain or discomfort. A score of 0 indicates a negative sign, no pain or discomfort, while a score of 1 signifies a positive sign, pain or discomfort. A score of 1 on 2 or more tests determine a positive finding for piriformis syndrome. Here is a sample of our Piriformis Test, which you can find on our Carepatron platform. To find our Piriformis Test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.